I think Tufts Medical Center is the ideal place to grow an infectious diseases career. We have the diversity of clinical experiences, diversity of research projects and opportunities here.
When I was looking for a fellowship program, a lot of it came down to the people. I felt like you could get a good training at a lot of the different places that I interviewed, but Tufts was a place that stood out where the fellows seemed legitimately happy and the attending seemed really invested in the fellows' education.
We do see a lot of kind of bread and butter of infectious disease, so skin and soft tissue infections, bloodstream infections. But at the same time, because it's a big transplant center, we do see more complicated cases in the immunocompromised patients. We have a lot of mechanical support, so there are a little bit more complicated cases. So I think my fellowship here at Tufts prepared me for, I think, whatever the world will throw at me, just because of the diversity of cases.
I've actually done all of my training at Tufts. I stayed on for residency and then fellowship here. What I've found unique at each step and hard to come by at other places is this really incredible balance between the size of the institution and the care that we provide and the training that we get. So, we are an academic tertiary care medical center in the middle of a large city, but we're only about 400 beds. And what that equates to is these really giants in their fields, faculty, who are generating research that changes or certainly contributes to the way we practice medicine, that are extremely accessible, and we're learning directly from them.
If a fellow is not quite sure what path they're going to take when they get their first job, 10 years out from training, we are the program for them because we have a nice mix of vibrant research, great clinical care, a passion for teaching, and so there's a little bit of everything.
I am actually starting a position with the CDC Epidemic Intelligence Service in a couple months, and I feel very, very excited about the opportunities there, but prepared to kind of jump in running with the skills that I've gained during fellowship.
It's a very, in a sense, low-key place to work in terms of interpersonal relationships. People are generous with their time. They like to help one another out, and that is particularly true in our division and within the Department of Medicine. The hospital leadership, the Department of Medicine leadership, is extremely supportive of infectious disease, and so that helps us grow our programs.
One of the great opportunities about infectious diseases is that it is somewhat of a buyer's market. So I encourage you to look around, ask questions, and get to know us. And even though we're in this unprecedented time and you have to get to know us by Zoom, I encourage you to do that and take time to meet with people who you find may have interests aligned with yours. We'll do everything we can to help you make those connections and learn more about what we have to offer.